Unhealthy eating habits have contributed to a lot of health problems epidemic today. Health problems like diabetes, high blood pressure, osteoporosis, arthritis, cancer, health disease, and so on. The good news is, if you can control what goes into your mouth and your body, you will live your best. For what you put into your mouth determines how well or sick you live. You and I know that poor diet is associated with major health risks that causes illness and even death. So, by making smart food choices today can help you protect yourself from all these health problems. Our integrative nutrition health specialist, Miss Betty Olainka-Folani Akinlosotu, aka Bufa, wants to see you living your best without any health issues. She made this known in her program showing every Sunday on Healthy Living with Bufa TV. She tells us how our food choice affects our health and how we feel today, tomorrow, and in the future. If you are opting for optimal health, from fighting free radicals to living your way into a healthy and beautiful body, here are some things you must do. Eat a nutritious, healthy, balanced diet every day. Practice your daily exercise and take your supplements, especially vitamin D, vitamin C, zinc, and chlorophyll to boost your immune system against free radicals that cause cancer and other diseases. Join us on this program every Sunday, 1:30 p.m. US time, 7:30 p.m. African time, and 6:30 p.m. United Kingdom time, where she educates on health and nutrition, as well as features professionals from various fields to sensitize you on wellness. See you there.
Hello, beautiful people. Hello, handsome people. Thank you so much for joining us again live on Healthy Living with Bufa. I'm Betsy Olainka-Folani Akinlosotu, aka Bufa. Hey, what do we have on Healthy Living with Bufa TV? Coming to you live on our YouTube channel. Today on the program, it's about cancer management. In all our three segments, from health corner to nutrition segment, it's about cancer management. So I will encourage you to sit right, fasten your seatbelts, because you're about to receive a vital information again today. And what are we talking about? It's about cancer. What is cancer? What are the causes and how is it treated? Today, our wonderful sister and expert, a woman who has been working tirelessly to make sure that that cancer we're talking about is cured, is managed. So I have on the program today, Dr. Temitope Olatunji Agunbiade. Dr. Olatunji has a Bachelor of Medicine and Surgery at College of Medicine, University of Lagos. She became a radiation oncologist, that is radiotherapist, after a fellowship training at the National Postgraduate Medical College of Nigeria. Dr. Olatunji is a member of American Society of Clinical Oncologists and European Society of Medical Oncologists. She is a fellow of International Atomic Energy Agency and National Cancer Cairo, Egypt. Currently, Dr. Temitope Olatunji Agunbiade is a consultant, clinical and radiation oncologist at Lagos State University Teaching Hospital, Ikeja, Lagos, Nigeria. Please join me in welcoming on the program, Dr. Temitope Olatunji Agunbiade. Doctor, you're welcome on the program. How are you doing? I'm trying to mute. Okay.
Good evening, everybody. Good evening.
How are you?
Thank you. I'm fine. Thank you for having me on your program. It's a great pleasure to be here and to share knowledge this evening.
Good, good, good. It's a pleasure to have you on the program as well. Welcome on the program. Doctor, let's quickly jump right into today's discussion. But before we go there, I want you to tell us, who is Dr. Temitope Olatunji Agumbiade, I'm sorry. Why is she a clinical radiation oncologist? Why is she not a medical oncology and treat cancer with chemotherapy and other medications? Why is she not a surgical oncologist and treat cancer with surgery or other specialties in medical field? Why radiation oncology? Tell us, what do you do as a radiation oncologist in 2 minutes? And I'm sure this would discuss more about the procedure or treatment radiation is all about. Go ahead and tell us what you do as a clinical radiation oncologist.
Okay, I'm physically a clinical radiation oncologist, and what I do is I treat cancer with ionizing radiation. I treat cancer with high energy, and high energy X-rays, X-ray beams, gamma rays, and electrons and proton. Basically, so what made me go into radiation oncology? I remember my story dates back to my internship days where I think I met somebody that had cancer, and they were in such a huge dilemma. They were looking for, I think they were looking for radiation therapy facility center. And then it was a little bit strange to me though, even though I've heard about radiation oncology, but the fact that I saw that they were suffering so much, they were in so much distress. And I was like, I think this is a field I'm interested in.
Wow.
And coupled with the fact that luckily for me, I already had a sister friend that was already, that started a radiation oncology training then. So I discussed with her and she was like, okay, why not? You also can come into the field. And that was what led me into it. I guess I was just lucky. So what is radiation oncology? I just quickly delve into it then. What I do basically is I treat cancer, all right? There are different modalities for treating cancer. They use surgery, they use chemotherapy, they use radiation therapy, they use immunotherapy, but I chose to do the radiation oncology aspect. And also, I see patients in clinic, I diagnose cancer, I go ahead and treat. So what is cancer? Cancer is a disorderly growth of cells. Everyone has cells growing in each and every one of us. From our head to our eyes, every part of the body has cells growing in there. So anything can happen in those parts of the body. So those cells can sometimes I jokingly say grow wayward, all right? Those cells can begin to grow rapidly, all right? So the body is in such a way that when the cells grow, when they grow to a certain limit, they are supposed to die out, all right? Scientifically, it is called programmed cell death. We know it as apoptosis. But in a scenario where there's cancer, there will not be programmed cell death. Those cells begin to grow abnormally. They continue to grow and grow and grow. And so when they grow, this be at the detriment of the normal.
We just lost our guest, and I'm sure she will be right back. Wow, internet, please don't disappoint us today. Hello, are you there? Are you there, Dr. Tokme?
Yes, I'm right here. I'm right here. I'm right here. Okay.
All right. So, let me quickly put this together so that you can answer all the questions in one answer. Right now, you just told us that the cancer can grow in any part of our body organs, right? People are used to hearing cancer of the breast, cancer of the lungs, cancer of the colon, cancer of this or that. I want you to tell us, what are the most common sites in which cancer develops? Common one that people should be very cognizant about. Tell us, because they all used to just the breast, just the prostate. I want you to tell us most common sites people should be aware of.
Okay. Cancer can occur in any part of the body, right? Because there are cells growing there.
Mm-hmm. Wow.
Even I have a mole here, all right? So in some people, the mole can undergo malignant transformation. Some they can have melanoma, they can have basal cell cancer of the skin, they can have squamous cell cancer of the skin. It can occur in the lungs. I mean, it can occur in the lungs, it can occur in the breast in females, although we still have some cases that breast occurs in male too. It's common in the prostate in men. It's common in the colon and the rectum, the cervix, the uterus, and it can occur in any part of the body. Those are basically the commonest parts that you find them. But rest assured, they can occur anywhere, even in the middle here, in the air, is as bad as that.
Wow, wow, wow. This is it's not a good news at all. But what can we do? We're born with these cells, and how they. Can you quickly tell us how this cell grows in our body? Because we have more than 30,000 millions of cells in our body system. This particular cells is the only cells that, you know, we have as the one that is going to become cancer in our body system. What actually make it grow that doesn't affect other, you know, cells, giving us this, you know, bad news that this die of cancer, that die of cancer? What exactly is the reason or the cause that will make it grow in our body system?
Okay, I mentioned earlier that it can occur in any part of the body, all right? What will make it happen is when there is mutation, when there is disorderly growth, when the process of programmed cell death is supposed to occur and it doesn't happen, and those cells begin to grow, all right, is when you have cancers, all right? So what will make cancer grow? Once it develops in a certain part of the body, all right? When it develops in a certain part of the body, it begins to grow locally, all right? When it grows locally, it can grow locally, or it can go through the bloodstream to other parts. It can go through the lymphatic drainage to other parts. But basically, it can occur anywhere. And when it occurs, they have different characteristics. Like cancers that occur in areas that are lined by glands, all right? Those ones, by the time they do the biopsy and histopathology, you find glands in them. Those ones are usually the adenocarcinomas, all right? When you find them in tissues, in muscles, they are usually the connective tissue mesenchymal tumors, all right? So basically, it depends on where they start from that would indicate what is going to manifest or what we're going to find in them.
Okay, the news according to the research that I got, and when I was in nutrition school, I also got some news, some information that what you eat also could be the cause of this cell growing, because I realized that there's some compound in your body system called antioxidants. This is the compound that fights against cancer cell. I mean, the free radicals that cause cancer. And once you can get those antioxidants in the food, mostly you get them from the food. If you can't get them from the food you eat, probably you're not eating the food that contains antioxidants such as fruits, vegetables, grains, nuts, and stuff like that. If you are not eating those things, you know, there's a possibility that you're not getting this antioxidants. Could this be the reason why this cells is growing in our body system or not? I just want our viewers to know that this could be one of the factors that makes it grow in our body system.
Okay, basically, I'll talk about the risk factors here. I'd like to enlighten us, all right? In some cases, cancer may occur sporadically. When they occur sporadically, in that situation, there is no known cause. However, there are some risk factors, all right? Diet is one of it, all right? I will mention that eating food with high calorie, they predispose to it, high sugar, high fat content, all right? Not eating enough vegetables and fibers, All right, we're not eating enough vegetables, not eating enough fruits, which are very high in vitamin contents, and basically they contain antioxidants that tackle these free radicals that are causative agents or that aids cancer formation. All right, that's one of the causes. Another cause that I will also mention is smoking and alcohol taking. All right, when you smoke or you chew tobacco, they contain carcinogens that predisposes to cancer, which includes like nicotine. All right. Other factor that we mention also is sedentary lifestyle. When you have sedentary lifestyle, there's obesity and all that. There are certain cancers that it predisposes to, like endometrial cancer, renal cell cancer, multiple myeloma, ovarian cancer, quite a whole lot of them. So I think, I don't know if I mentioned alcohol. Alcohol also is culpable, all right? Like in cervical cancer, in quite a number of, cervical cancer, breast cancer and all that. I think I should not forget to mention that smoking is also a major risk factor in lung cancer, all right? Exposure to sun is a risk factor. Exposure to sun, ultraviolet radiation, to radiation as well. For all you care, radiation also can lead to secondary malignancy. If a patient is being managed and is not well shielded, they can develop second malignancy sometimes in life. And also, viruses are culpable too, viruses. You have the human papilloma virus, which is sexually transmitted. It is culpable in oral cancers, the genital cancer, genital cancer, cervical cancer, head and neck, oral tumors, you know. Then also HIV. We have some cancers that okay, we list them as HIV-related cancers. They include the squamous cell carcinoma of the cervix, the Kaposi's sarcoma, if squamous cell conjunctiva, squamous cell of the conjunctiva. When you see those cases, all you have to just go back and screen those patients, and you may find them that they're HIV, that they have cancers or they are HIV positive. Okay. Also, hepatitis B. Hepatitis B is a virus, because if patient have hepatitis B and is not well managed, over time it can degenerate to hepatocellular cancer. I mean, layman language, cancer of the liver. Basically, infections as well. The H. pylori infection. If it's not properly managed, sometimes somewhere down the line, patient can come down with gastric cancer. So, but basically, these are major things that can happen. Then I think genetics as well. Some cancers are hereditary, or should I say familiar? You can use them interchangeably. Some genes are passed, or some diseases are passed from generations to generation. In some family, when you see them, their history, it may just be breast cancer that they have, or in some of them can have breast cancer, or they can have combination of breast cancer, ovarian cancer, and prostate cancer in their male. So these basically happen. These are most of the majorly the risk factors that can predispose patients or people to cancer. Thank you.
Thank you so much. I just got a question from one of our viewers from YouTube. YouTube comment now, and it's asking, that's Engineer Bosoyi Oladure. He wants to know what lifestyle habits, if any, enhance or suppress the development of cancer cell.
Okay, number one, our diet. All right. Most people are careless about what they eat. They eat a lot of junk foods. They eat fat. They eat food in low fiber. All right. Like in the case of the cancer of the colon now, you need to eat food that is rich in fiber, not just food that is fatty, that contains so much beef, processed meals, and all that. So we should include a whole lot of green vegetables, fruits. Fruits are very important. They are rich in antioxidants. Then say no to sedentary lifestyle. I mean, do exercises, all right? Then also, you should go for your screening. You should go for screening at all times. All right, you should go for screening, yearly screening, just make sure that you're taking care of yourself. If you gain weight, make sure you do exercises, eat well, rest well, don't smoke, don't take alcohol. But if you have to take alcohol, in moderation, basically.
That's it, in moderation, because our body need alcohol anyway. Doctor, I've heard and seen many people who had cancers, various type of cancers, and the people have no idea of what the diagnosis was. And this has, taken, many lives, because there's certain things they need to do. There's certain steps, some steps they need to take, but they have no idea of this. I want you to tell us, is there anything we must do? I mean, what do we do to identify this disease earlier than, when it is too late for us? And if detected, what is the most appropriate course of treatment? Because I imagine someone is sick and the symptoms the person is having is cancer symptoms, but because we don't have information, we don't have knowledge of what could be the reason of those signs, the doctor this person is seeing is treating something else, such as ulcer, instead of cancer. So in this case, what do we do to identify this disease earlier than before?
Okay. Lately, there have been cancer awareness, enlightenment. There's been increased enlightenment, unlike way back where people say spiritual attack and this and that. We're beginning to see more patients that are coming forward that they have cancer now. But what can we do? Screening is number one. Early detection really helps a lot. When patients go for their yearly screening, or the mass population, the general ones that they do at institution, basically advocacy screening, all right? So, but when they are able to do this, they are detected, they are enlightened, they get to meet a group of people that are there, they tell them this is what you are supposed to do, all right? Then there are support groups all over now, they're talking about cancer, this and that, so people are beginning to get more aware. But I always tell patients that if you have any symptom and you're being treated somewhere, get a second opinion, or just get a second opinion elsewhere. Don't just stay where you're. Then some people, some local people, they just they say they are treating malaria. They say they are without doing investigations. People should insist that they want to get tested. They should go for screening. They should do tumor markers. They should do chest CTs. They will do CTs. They will do ultrasound scan. They will do MRI. That's basically it. There are some centers around that offer full package screening. So if they go for those kind of screening, they will be able to detect that they have cancer, whatever it is that is going on, will be picked early. So how do we now, if eventually make a diagnosis, so how do we now know what to do for those patients? Anyway, treatment is individualized. What goes for this person may not go for the next person. Yes. And again, even if it's breast cancer, tumor biology differs. We may have like 10 cancer patients, 10 breast cancer cases with different tumor biology. This one may be triple negative, or that one may be positive, but they basically have different tumor biologies. And when they have different tumor biologies, they have different forms of treatment. Okay, I mentioned that cancer generally, the cancer treatment is generally individualized. The treatment is not just, decision is not just made by one person. Is made by a group of experts. I call it a multidisciplinary team, all right? We all sit together, we discuss the case, what is the main, how do we go about it? Because I think I mentioned earlier that we treat cancer with different modalities. There's surgery, there's chemotherapy, there's radiotherapy, there is immunotherapy, there's targeted therapy. So when we all come together and make a decision on these patients on what to do for them, so then we now know the exact treatment. For some patients, they may need to take chemotherapy first, in case like in a form of neoadjuvant chemotherapy before they go for surgery, or after their surgery, they have to go for radiotherapy. So basically, you need to individualize treatment. What goes for this person may not go for the next person. All right. So, that's how things happen.
I agree with you. I agree with you. Let me quickly read another question from YouTube comment. This is Prince Adewale Abgafar. He wants to know, can you please elaborate on the management of hepatitis? He wants to know more about hepatitis.
Okay, hepatitis basically is managed by the gastroenterologist, okay? So if you have hepatitis, you need to go to the specialist in that field. Go and see the gastroenterologist. They have medications that they give. It is better not to have it at all. But once you have it, you need to be managed by the endocrinologist, the gastroenterologist. Go and see them. They will guide and direct you on what to do.
Good. Thank
so
you.
that it doesn't degenerate, so that it doesn't degenerate to cancer on the long run.
Thank you so much. I was about to ask you before I got the question from YouTube comment. What are the side effects of this radiation treatment, and how can patient be managed the side effects of the radiation treatment?
Okay, once we know that a patient is supposed to go for radiotherapy, there's certain things we have to look out for. Then we need to also prep the patient. All right. If a patient is going for radiotherapy, then depending on the part of the body that is going for, like if it's in the head and neck, we need to do oral check. We send to the dentist if they have dentures and all that. If it's going to be in the head and neck still, because we know that once they start treatment, one of the side effects may be pain in the throat. They may not be able to feed. We'll tell them to go for feeding gastrostomy so that their nutrition is not affected. All right. So then, apart from that, we need to do their blood workup. Is this adequate? Is it okay? Because in the case of radiotherapy and you are going to radiate areas like patients that have bone metastasis, and you need to radiate a large chunk of area that contains bone. Like majority of the blood that we use in our body is produced in the bone marrows. Yeah, because we know that myelosuppression is a major side effect. So we want to make sure that that patient is optimized. We want to make sure that their blood count is adequate, their platelet count, the white cell count, everything is adequate. And if we're going to radiate a large field, we'll do them in sections. We don't just treat or radiate them like that. So basically, if it's going to be from the skin as well, we tell them the things that they will expect. Like when they start the treatment, there may be change in skin color, there may be redness, there may be desquamation. We call it desquamation. The skin may be peeling, it may be dark, there may be telangiectasis, there may be epilation, even removal of hair, like those patients in the head and neck area. Then they may have fatigue. They may have a whole lot of tiredness. They may be nauseous. They may be fatigued. So even if it's in the lower part, the pelvic region, there may be cystitis. They may be feeling like they want to pee. They may have proctitis. Tenesmus. This means they feel like pooing. They go to the toilet. Nothing is happening there. It is just basically part of the side effect. Even some, they may even start bleeding per rectum, all right? So, but this is not to scare patients. If it's in the brain, because we radiate the brain, we give them steroids to reduce swelling around the brain, because when we know that when we start to radiate, then there may be swelling. So we'll give them steroids to reduce swelling around the brain and also around the spine if we're going to. But basically, we also do weekly checks. We do weekly check, we do their full blood count every week. We make sure that they're well covered so that when the treatment starts, there won't be any issues and they will be able to tolerate all the possible side effects. We also give anti-vomiting, we give antiemetic drugs, we give pain relievers and all that. So to make it tolerable for the patients.
Thank you so much, Dr. Olatunji. I'm going to read the next question from YouTube, and it's coming from Mr. Oniti Jukende. He says, well done, ma. You're welcome on the program. So please, how can a man detect intestine tumor at the initial stage? And what is the management for solution? Is the same person asking the same question.
Okay. I mentioned earlier that regular screening, it's part of the preventive method. People should go for yearly screenings and all that. Colonoscopy, they should do tumor markers. Even their stool, they check their stool for occult blood. I know some people when they check their stool and they see alcohol blood, they just book them for colonoscopy straight. And what is colonoscopy? It's is a test where they put things through the back passage, the rectum. It goes as far as eye to all the blood to visualize and see if there's anything going on there. So if you have a culture of doing all this regular screening, there is a high chance that if anything is going on there, it will be picked on time. Also, they'll do tumor markers as well. So if they do all those ones, if there's anything, they will definitely pick it. And if it happens that something like that, because some patients, they don't go for it, they just present with features of intestinal obstructions or change in bowel habits, like the way they used to go to toilet, they are not able to do that. They anything they eat, they can't tolerate. They are vomiting. By the time they go and do radiological investigation, they find that there's a mass or there's a narrowing in their bowel. And so when that happens, they go in and take a little bit of sample, or they just go ahead and do surgery to bring it. When the histology comes out and says it's cancer, all right, we just go right ahead. I mean, there are different modalities, like I said, surgery, chemotherapy, and all that, or even targeted therapy, depending on the stage where the disease is. Unfortunately, most patients come down, they get detected in late stages. It's rather unfortunate because most of our people, they don't have this culture of going for screening. So we are just advocating that people go for screening. I mean, now we've been saying that from age 40.
I'm sorry, Dr. Olatunji, that's where I'm coming back, and that's going to be our last questions on, one before, the last before the questions, I'm sorry.
Okay.
See, I want to ask, you've told us what cancer is, the causes, the side effect, the management, the treatment. You've told us all that, which I believe our viewers, got all that. Now, how do we reduce the risk and prevent cancer? Even we don't want it to happen at all. That will take us to treatment or, chemo or radiation and stuff. We don't want that to happen. Tell us the best way to reduce the risk and prevent cancer.
I think I should start with enlightenment, screening. I just discussed all that, going for regular checks and all that, okay? I won't delve into that again. Another major factor is healthy living, having a good diet, living a good life, taking a whole lot of vegetables, low calorie meals, fruits that are rich in vitamins, vitamin C, antioxidants, low sugar, low fat, no junk meals, and if you are going to eat in moderation. Avoidance of tobacco, it is really hazardous to the health. If possible, avoid alcohol, but if you can, but please take it in moderation, all right? Say no to sedentary lifestyle. You should involve yourself in activities that will just make you move around, emotionally be stable, protect yourself from sun. If you have to be in the sun, use
sunscreen.
Cream. Yes. You can use shields, or you use creams that have SPF 30. It has a broad spectrum, so it will protect you from the ultraviolet radiation. Get vaccinated. There are vaccines. There are vaccines everywhere now, even for cervical cancer. They said for children, for boys and girls from age 9 to 12, or 15 or 12, basically, or thereabout. Luckily now, there's vaccination Gardasil 9 for people from age 9 to 45. I mean, before you just used to be people that are not sexually active, but now there's a vaccine Gardasil 9. It's just recently been approved for people from age 9 to 45. So you can go ahead and get those.
Is it the same vaccine we call HPV vaccine, because they're giving those?
Yes, that's it. Okay. That's it. Okay. Then avoid risky behaviors.
Okay.
Risky behaviors, practice safe sex.
Safe sex. That's the key word.
Safe sex.
sex.
Safe
Because some
sex.
people are
I mean,
so
avoid
careless. They
partners
trust
with
each
multiple
other.
partners.
Yes, yes. Thank you for mentioning that. And that is the
No to needle sharing. No
Mhm.
to needle sharing.
Yes.
Go for medical regular medical screening.
Thank you so much, Doctor. Let me quickly read all the comments we're getting from the YouTube, our social media to you. We have, oh my goodness, thousands of people sending message to you saying, thank you, Dr. Tokwe Olatunji, for coming on the program. God bless you. Thank you for this enlightening in this topic about cancer. And that is from Mrs. Titilayo BG, yes. And we have another greeting from our father, Professor Sabit Ario Olagoke JP, saying thank you for this enlightenment. And we have a message from Honorable Tolulokwe Ayoride, says thanks for sharing this important information. God bless you.
Thank you, sir.
This one, Joseph, it's saying nice to be on this program. Thank you, Doctor. And more Dr. Oluwato Singh Akinshola, that was our last 2 weeks ago guest on this program. It's also a doctor, epidemiology doctor. He was on the program. So it's saying good day to all and welcome on the program. And more and more like that. Thank you so much, Doctor. And that's just the comment. Let's quickly run through the remaining question for us today. Last time I spoke to you, you were sharing, you mentioned that there is no PET CT in Africa. That is post-traumatic emission tomography, an image that tests the uses of radio tracer to assess organ and tissue functions. And when I hear this, I felt like, seriously, so how is this thing done in Nigeria? How is this evaluation of this diagnostic test is being done in Nigeria? How? No wonder people are not going for the test they're supposed to. I know we have mammogram, we have X-ray, but this particular imaging, PET scan is the one that we really need for management of the cancer, to do the testing, to do the whatever you want to do. You can do it on this. And it's not even in one country in Africa. And this is the reason why I took my time and tried my best possible to make sure that I bring on this show the largest company that produces diagnostic machine. He will be joining us on this program. One of their representatives will be joining us by this June 38th, June 27th precisely, is going to be on the program. I want you to tell us a little bit about PET scan, PET CT. What is the uses of this and what is the importance of that? I want people to know how important this thing is.
Like I said, early detection and prompt treatment, early detection, diagnosis, and prompt treatment is the way forward. We have other testing modalities in Nigeria, but we have CT, we have MRI, we have X-rays. However, we do not have a PET CT. We don't have it in West Africa. We don't have it in Nigeria. The only place I know I've seen it is in Kenya. I remember, I think I saw it at Aga Khan when I was in Kenya. They have it there, but if my patient have to do PET CT, sometimes they have to go as far as Cairo. I send them to Cairo, they go to India, they go to South Africa, or even UK or US. It's rather unfortunate. PET CT, it's preferable because it detects, is a major test that detects metabolic activity of cells. What do I mean by this? It detects growth. You know, cancer cells, they grow. It's going to grow by cell division and all that. So that mitotic activity, it will be picked. It's otherwise known as metabolic activity. It will pick by this investigation. You can actively see it as a hotspot. You will see it there. I mean, I wish we can have it. We need major investors to come and give us this PET CT. It's rather unfortunate. If people can invest in it, private partnership or or the government can do this for us in West Africa, in Nigeria, I mean, we will be the happiest people down here. I mean, it really helps you because those cancer, basically, you need to stage them. You need to stage them. It helps us in staging. And when you stage, you know the kind of treatment that you are going to give them. I mean, treatment outcome basically depends on the stage of the disease at arrival or on diagnosis. Some patients, if they come at stage 4, there isn't much that you can do. Your intent of treatment is just palliation. If you're able to get the disease early, that is just still localized in that particular area, or it just locally advanced, we can still do something. And all these machines will help us. Even though we can still see them with CT and MRI, but those ones will not really pick it out as much as the PET CT. So we need the PET CT. We need people to look into that PET CT in West Africa, in Nigeria.
Wow. And I believe we have very important people on the program today. We have, very high personalities on the program, and they are listening to us. If the government is not doing this, I think it's coming in form of business and investment. And thank God we're bringing the company that produces this kind of machine. And if you are interested, contact me, let's do business. We must have it in Nigeria. There's one that we use in where I work, Radiation Oncology. And this thing is like injection that is, injected to the bloodstream of the patient who is diagnosed as cancer, and it runs through your body for 1 hour. And doing this for 1 hour, it just find out and detect any part of your body that is growing cancer, any cells in your body that is growing, in fact, I've seen it, it's like, wow. So within 1 hour, this injection is, injected into the bloodstream. It's just X-ray your body, any part of your body that will have cancer, you got it. So it's not like you're going to do breast test cancer today, tomorrow lung cancer. No, this one,
everything.
Within 1 hour, everything is screened out. And this is one of the reasons I'm bringing this company on the program, June 27. Look out for that. And don't forget the date to join us. My goodness, bringing this interview to a close, I would like to thank Dr. Olatunji Agunbiade for coming on Healthy Living with BOFA show today to educate us on cancer management. We really enjoy and appreciate your time on the program today. And that was awesome. Trust me, all you've been telling us, saying some of the questions you answer, many people ask me, I try my best based on my skills and my background in oncology. I answer them, but thank God you released me today. And I'm sure the person is on the program today, nobody will ask me any question on cancer anymore, because you've told us all we needed to know. And thank you so much. I pray for nothing but good health and peace in everything you do. I hate to say goodbye to our guests, but unfortunately, we gotta go because of our time. So be safe, healthy, and have a good night, Doctor. Thank you for coming on the show.
Thank you for having me. Thank you for having me. It's been a pleasure. It's been a pleasure.
Thank you so much. Bye.
And if they still have any question, they can find me on LinkedIn. If they can reach me, if they have any question, they can hook up with me there. I also consult for Oncopadi. Oncopadi is an online networking system that groups people together. They have issues. They meet us there. And also I'm at LASUTH, Radiation and Clinical Oncology Department. If they need to reach out to me, there they can reach us. Thankfully, God has given us the grace to be one of the 100 clinical and radiation oncologists in Nigeria. We thank God for that. Thank you so much for joining us for this program. God bless you.
God bless you too.
Thank you.
Have a good night.
Thank you. And you too. Bye.
Our viewers, let's have a break, and when we return, we're going straight to our nutrition segment, because all you need to know on Health Corner We've already discussed that. So please stay tuned and let's have our nutrition segment. Stay tuned. We'll be right back. Okay, welcome back to nutrition segment. This is the segment we've all been waiting for as other segment. The reason why we say we don't need to go for health segment is most of the things we're going to teach or educate on Health Corner has been answered by our doctor, our guest on the show on Interview with Expert segment. But I'll do something which I'm going to have the PowerPoint presentation share so that you can all have it on your phone and read at your own convenient time. So I'm going to do that. But right now, because of our time, let's do nutrition, talk. We've been taught what cancer is all about, the causes, the treatment, and basically how to manage it, the risk factor, and how to prevent it. And thank God that our guest mentioned nutrition in our discussion. So today, I'm just going to mention other steps you can take to prevent cancer based on diet. First thing you want to do, if you want to reduce or avoid grilled meats, when some people buy fresh meat, they put it right there on the grill. And when you cut it, you still see blood coming out. And this blood coming out will still have bacteria in that meat. So you want to avoid or reduce it. If you have to take it, reduce it. Or better, you don't take it at all, because a lot of bacteria come from red meat, mostly from meat, unlike fish. So please reduce and avoid grilled meat. And you want to say no to secondhand smoke. Our doctor has told us that. I'm saying this because it is very, very important, and it's one of the risk factors that causes cancer. Please say no to that. Don't smoke. Quit smoking. And many people, I was gonna say something on Health Corner, then I'll still do that. I want to give you the statistics on cancer cases and deaths. And breast cancer and lung cancer have highest numbers. It's about 2 million people died of breast and lung cancer because we smoke. And for the breast, we don't do screening. And the highest rate is coming from Africa because we don't do screening on time. Even self-examination, most of us don't do it. Every morning you should be able to do self-examination. Touch your breast. Do whatever you want to do with it. And see if there is any lumps, pains in your breast, and quickly see your doctor. It's very important. Your man is touching your breast all the time. What stops you from doing the same thing to yourself? Your man cannot discover this. He doesn't know where it's paining you, what is in your breast. You feel the pain, you go and see your doctor. And if you smoke, your lung is at risk for many diseases, not only cancer alone, many diseases. The research says this. So please say no to second-hand smoke, quit smoking. So another thing you want to do, which is very important, you want to eat nuts. You want to eat cooked tomatoes. You want to eat purple tomatoes. You want to drink green tea. It is this thing I told you, if you can live on this, I'm telling you, that cells in your body will not, the cancer cell, will not grow. And the bottom line is this: cancer prevention involves, number one, you want to avoid tobacco smoking. It's very important. You want to eat healthy. You want to eat healthy by eating fruits and vegetables. Why? Because you need antioxidants, vitamins, proteins from the food you are going to eat to fight against the free radicals that cause cancer. This is the reason why you must eat healthy. If you choose to drink alcohol, doctor said that you want to do it in moderate. You want to limit processed meat, processed food, those junk food in the can. You want to stop them. You want to maintain a healthy weight and be physically active. Protect yourself from the sun, like doctor said. Get vaccinated. That is very important. Vaccination for hepatitis B, HIV, HPV, you want to do so. You want to avoid risky behavior such as unsafe sex. It is important. Don't share needle. Doctor has said that. Get regular medical care. Ladies, do your mammogram. Do your pap smear. Go to your doctor once a year and do this. Men, do your prostate. It is once you are age 50, you must do your prostate test. It is very, very important. And these are the vital things that we need to do all the time. It costs us nothing. I know in some parts of the country, it costs us a lot of money. But trust me, it's worth paying 50 naira or $50 now than waiting to buy thousands of medications, going for surgery that will cost you millions of dollars. So it's better we prevent it now than waiting till it gets out of hand. Some people couldn't make it. Some do mastectomy, we call it removal of the breast. They still don't make it. I've seen different kinds of cancers. I was like, my goodness, I feel like I'm not part of them. And I have this thing in my body. You have it in your body system as well. But how they grow depends on what we eat and our lifestyle in general. So please and please do the necessary thing that you need to do to be on a safer side. If anything happens, just know that you've done your part by doing your screening, eating healthy, and following all the things that you need to do, and leave the rest to God. I'm going to leave you with this to please and please, everything you learn on this program is coming from the right source. We're not making up this. It is what is happening in the world. And thank God we have been told, and the research also supported it, that cancer is the leading cause of death in the world today. Are we going to wait until everything gets disrupted or taking our lives? No, we don't have to do that, due to our negligence or ignorance to certain things. We just think it doesn't matter. Please do your best. May God help you all. Ladies and gentlemen, the most beautiful things you can do for yourself is to eat and eat good, nutritious food. Wear good clothes and be happy every time. Make yourself happy even in the midst of nothing. These are the only good things that go with you to that 6 feet on the ground. Nothing. I say nothing will go with you. Not even those cars. Not that mansion. Not your families or friends. None of them will go with you. It is only you and the food you at last when you say goodbye to this world. Please don't forget this. And that is all we can give. We can educate on healthy living with BOFA today. I wish you all safe and good health. Don't forget to subscribe to our YouTube channels at Healthy Living with BOFA TV. Follow and contact us for any inquiry, adverts, promotion, questions on health-related issues or nutrition. Our social media handles as follows. Instagram, Healthy Living with BOFA. Facebook, BOFA Live Healthier. And our website is www.hlwbofa.com. And you can also reach out to us on this number, +1 917 889 6854. WhatsApp only, please. Please continue to stick with Healthy Living with BOFA TV. Once again, I want to thank you all for broadcasting with us today again. God bless you all. I'm Betsy Olayinka Folarin Akinlosotu, aka BOFA, coming to you live on Healthy Living with BOFA. I'll see you next week. By God's grace, be safe and be healthy. God bless you all. See you next week. Bye. Thank you.